Today's topic is disease of the hematological system, that is disease of blood. For HS second year, father of medicine is Hippocrates. Normal hemoglobin in male 14 to 18 mg%, 13 to 17.5 gram per dl. In female 12 to 16 mg%, that is 12 to 15.5 gram per dl. In children 11 to 13 gram per dl. Anemia is defined as a clinical condition characterized by decrease in hemoglobin concentration in blood or number of RBC according to age and sex. Causes: blood loss, trauma, injury, menstruation. Inappropriate iron intake, increased demand of iron during pregnancy. Disease of blood, defect of RBC membrane, spherocytosis, change in structure of RBC or hemolysis, sickle cell. Hemoglobinopathies, hemolysis, increased breakdown of RBC is called hemolysis. Autoimmune disease. Classification of anemia according to loss of blood: acute anemia, chronic anemia. Acute anemia is due to acute blood loss. Chronic anemia is due to worm infestation, Kala-Azar, malaria, chronic kidney disease. According to shape and size of RBC: microcytic anemia, macrocytic anemia, normocytic anemia. According to color of RBC: normochromic anemia, hypochromic anemia, hyperchromic anemia. Anemia is in chronic diseases such as liver disease, kidney disease, and heart disease. Clinical features: it includes signs and symptoms: pallor, breathlessness, lethargy, nausea and vomiting, tiredness, loss of appetite, headache, dizziness, chest pain. Chest pain is also called angina. Syncope is also called loss of consciousness for few seconds. Right? Palpitation, self-awareness of the heart rate. Pallor, tachypnea, respiration rate more than 30 beats per minute. Tachycardia is heart rate more than 100 beats per minute. Cyanosis, blue discoloration of the mucosal membrane. And hemoglobin less than 5 gram%. Diagnosis is by clinical according to signs and symptoms. Investigation CBC, that is complete blood count. Total blood count. Iron profile. In iron profile we see the serum creatinine level, iron binding capacity, and stool for OBT, that is occult blood test. UGI endoscopy, bone marrow aspiration and cytology, vitamin B12 and folic acid supplementation. Treatment: control the causes, supplement of vitamin B12, iron and folic acid, balanced diet, blood transfusion, bone marrow transplantation. Iron deficiency anemia, it is very important for the exam view. It is most common anemia worldwide, affect almost 30% of population. This is because of the body have limited ability to absorb iron and frequent loss of iron. Causes: inadequate intake of iron, disturbance in absorption of iron, gastric disease, high altitude, intestinal mucosal disease, menstruation and pregnancy. This is increased demand of iron. Post gastrectomy. Clinical features: brittle nail, spoon shaped nail, anglostomatitis. Stomatitis is the inflammation of the angle of mouth. Brittle hair. Glossitis, inflammation of the tongue. Dysphagia is difficulty in swallowing. Dyspnea is difficulty in breathing. Investigation: peripheral blood smear, serum iron binding capacity, it is increased. Serum creatinine level is decreased. Bone marrow aspiration and cytology. Treatment: take bed rest, take adequate and plenty of liquids, take iron containing balanced diet. Drug: oral iron therapy, tablet ferrous sulfate 200 mg per oral TDS 3 times for 3 to 6 months. If needed, parenteral therapy, then injection dextran, ferrous sulfate, gluconate, blood transfusion. Anemia of the chronic disease. It occurs in a patient with chronic infections such as kidney disease, liver disease, heart disease, TB, connective tissue disease. In this condition, there is a decrease of iron, which decreases bone marrow to develop erythrocyte inadequate and lead to anemia. Causes: inadequate supply and increased demand of iron and folic acid. Chronic liver and kidney or lung disease. Investigation: complete blood count, TCDC as a percent is decreased. Morphology: lipid profile, total iron binding capacity is decreased. Serum ferritin level is increased. Treatment: treat the chronic causes, oral and parenteral iron therapy. Megaloblastic anemia, also called pernicious anemia, it is very important in exam view. This anemia is characterized by normal erythroblast with delayed nuclear maturation due to deficiency of DNA synthesis. Causes: inadequate diet, अनि त्यसपछि vitamin B12 deficiency or vitamin B12 malabsorption. Vitamin B12 is called cyanocobalamin, B1 is called thiamine, B6 is called riboflavin, vitamin B6 is called ascorbic acid, and vitamin A is also called retinol. Folic acid deficiency, anti-cancer drugs such as methotrexate, myeloproliferative disease. Clinical features: fatigue, headache, restlessness, palpitation, faintness or dizziness, red beefy tongue, angiostomatitis, ataxia, neurological changes, dementia, altered sensorism. Investigation CBC. TCDC as a person, hypersegmented neutrophil, bone marrow aspiration and cytology, iliac bone, sternum ribs, liver function test, serum bilirubin is increased, serum vitamin B12 level is decreased. It is found by skilling test. Serum folate level normal or increased. Treatment supply balanced diet, oral folic acid and vitamin B12 supplement. Rule out secondary causes and treat it. Give blood and blood product transfusion. Bone marrow transplantation. Aplastic anemia. It is defined as pancytopenia, all cell decreased with hypocellularity of bone marrow. There is abnormal cell in peripheral blood smear. Causes. Primary causes congenital Fanconi's anemia, idiopathic, unknown causes. Secondary causes chemical, benzene, drugs, chloramphenicol, radiation, viruses as cytomegalovirus, herpes simplex, HIV. Clinical features severe anemia, headache, fatigue, palpitation, lethargy, tachycardia, chest pain, severe infection due to decreased WBC. It is severe infection is recurrent. Increased bleeding tendency due to decreased platelet. Lymphadenopathy, enlargement of the lymph node. Splenomegaly, enlargement of the spleen. Hepatomegaly, enlargement of the liver. Investigation CBC. In CBC, we see WBC, RBC, platelet all are decreased. Bone marrow examination, hypocellular marrow, USG of abdomen to rule out organomegaly, either spleen or liver. Treatment management of aplastic anemia depends upon supporting care with bone marrow recovery, bone marrow transplantation. Steroids can be used. Blood product replacement. Hemolytic anemia. It is defined as anemia due to destruction of RBC. Causes. RBC cell membrane defect. Enzyme deficiency. G6PD is the enzyme found in liver. Autoimmune disease. Hemolytic transfusion reaction. Infection. Malaria, Kala-Azar, liver disease. Drugs and chemicals. Clinical features: jaundice, yellow discoloration of the mucosa, itching, weakness, angina, tachypnea, tachycardia, vomiting, palpitation, splenomegaly. Sometimes investigation: full blood count, it is RBC is decreased, serum bilirubin level is increased, direct comp test, it is positive, it is done by agglutination test. Osmotic fragility of RBC is increased. Treatment: dietary supplement of vitamin B12 and folic acid, blood transfusion, prophylactically antibiotics, splenectomy. Complication of anemia: respiratory failure, right heart failure, myocardial infarction, hypoxic encephalopathy, respiratory acidosis, disseminated intravascular coagulation, hemorrhage. Leukemia is also called blood cancer. It is defined as a neoplasia of hematopoietic cell, mainly WBC. There is immediate proliferation of blast cell inside the bone marrow. Causes: radiation, chemicals, benzene, drugs, chloramphenicol, antiseptic, chlorambucil, virus, cytomegalovirus, Epstein-Barr virus. Types: myeloid, acute and chronic, lymphoid, acute and chronic. Acute myeloid leukemia AML, most common in adult. Chronic myeloid leukemia CML. Acute lymphoid leukemia all, most common in children. Chronic lymphoid leukemia CLL. Clinical features: anemia, fatigue, palpitation, tachycardia, chest pain, dizziness, headache, pallor. Infection: skin infection, oral ulceration, oral thrust. Increased bleeding tendency: gum bleeding, nose bleeding, pitachi. Pitachi is the multiple blood dots appears on the body surface. Hepatosplenomegaly, lymphadenopathy, fever. Investigation: peripheral blood smear, hemoglobin percentage is decreased, leukocytosis or leukopenia is decreased, thrombocytopenia is decreased, blast cell is more than 30%, uric acid, LDH or lactate dehydrogenase, cytogenic analysis, immune phenotype examination. Treatments: the first phase of therapy is a high dose intensive chemotherapy to reduce blast cell. Drugs for chemotherapy: doxorubicin, oxorubicin, vinblastine, vincristine, cyclophosphamide, etoposide. High dose of steroid given, corticosteroid. Stem cell transplantation.